Hi. Hello. How are you doing? You must be my next patient, is that correct? Great, great, great. Mm-hmm. Well, I am Dr. Bay. Mm-hmm. Yes. So I heard that you had a bit of a fall. Is that right? Yeah. I mean, accidents happen, but hey, better safe than sorry. We're glad that you're here getting checked out. You know, even things that we think are minor sometimes, it's just a good idea to get it looked at. Get that clear bill of health, be on your way. Don't need to worry about anything else. Right? That's what we're here for. Perfect, perfect, perfect. Now, just to make sure, procedure, I need your name and where you are, what we're doing, and your date of birth. Standard procedure, just to make sure that we're good. You're good too. Okay. Mm-hmm. All right, yeah, know who you are, when you were born. Great, great. Mm-hmm. Yep, same thing I have here written on your chart. Perfect, perfect, perfect. Okay. So, let's see here. Okay. Just getting these gloves. Not that I think that we're dirty or anything, but just to protect you from me, just to protect me from you. I do see other patients throughout the day whom are not just experiencing any head injuries, things like that. No. People who are sick, I could get you sick and me sick. And if I'm not sick yet and I'm just spreading my germs everywhere, I do wash my hands. You saw me do that. But yeah, just to be on the safe side. I don't think that doctors died during the Civil War just because they were caring for the wrong side of history. They died because they had no comprehension of germ theory. Okay, good. You did pick up on that joke. But yeah, serious business though. Germs can kill you. Mm-hmm. Okay. Now, for this first one, I'm just going to present a little series of vials to you that have smells in them. Some of which that should be very recognizable. You'll know right away if it smells bad. Just tell me what it kind of smells remnants of. Very popular things. If it smells good, tell me what you think it smells like. That also helps, just so we can gauge of if 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 there's a problem, we can pin it down, track it down, get it isolated. Okay, so okay. Okay. Yeah, that's what that would be. Okay. Next one. Hard to place? Here. That might. Okay. Okay. No, you're doing great. This is good. Nothing out of the ordinary so far. This is all to be expected. We're good. Don't worry. These are the easy ones, don't worry. Okay? Okay, so this one, I'm gonna use the light, and I want you just to follow it, you know, going to do some up and down, side to side, side to side, diagonally across the screen, going upwards, diagonally across the screen, going downwards. And all you have to do, follow the light. Simple enough, yeah? Okay. Good. Okay. Okay. Now, I'm gonna start side to side. Go up and down. Let's go up and down again. Okay, we're gonna go across. Very good so far. Just gonna let your eyes rest a bit. So this time, I'm not gonna go as slow, because the last time I was just doing that. I was watching the movements of your eye, making sure that they're moving normally, and things like that at a regular pace, no lagging. Yeah. Now with this, I'm gonna do the same thing again, but it's gonna be just a little bit faster. I'm gonna just speed it up, kind of just testing the responsiveness, because while I was going slow to study, now I'm just gonna make sure that it functions as normal as expected, as if something quickly were happening and you needed to get your own attention or be very alert. This lets me know that you would have a good response time and we wouldn't have to worry about anything like that, okay? Okay, good. Okay, so rapid fire round. Okay, excellent, excellent. You're doing very, very well. Okay, go up and down, up and down, up and down. Just keep following it. Keep following it. Great, great. Like I'm Xing it out, exactly. We're checking the boxes of our exam, right? All of your functions are A plus so far. Great. Okay. So we're going to come back to the eye in a moment because I'm going to make sure that your pupil dilation is good. But for a moment, what I'm going to do probably now is I want to see if you could try what I have in these vials. I have a couple of things just to taste. I think that this would be great, just so we can make sure that while you're this smelling sense is great, we want to make sure that the taste and the smell can still align, and that they can still make sure that the same smell will taste bitter, and that your brain is able to match the two together, so on and so forth, for other smells and tastes. So I'll let you. Yeah, sorry about that. That's okay though. That's okay. It should go away very, very quickly. It's a diluted taste. It's fine. Okay. Number 2, are you ready? Great. Much better. That's correct, yeah. This would be a fruit punch flavor. That is correct. Much more fruity. So now I'll do this next test really quickly. Then we'll go to the eye and we'll wrap up with another hearing test, and then I'm gonna do kind of, I guess, like a strength test. But before we get to that, I want you to bite down as hard as you can, as if you were trying to show me the muscles in your face, maybe along here, right? Or potentially along the jaw. Yeah, anywhere that you feel most comfortable clenching those muscles, that will help me. Basically, what I want you to do is kind of act like you were chewing, but chewing really hard because you want to emphasize that. Exactly. Okay, so is it okay if I touch your face? Like in this area, I'm just gonna go like this while you do that. Okay, good, good. Okay, so, all right, go ahead and bite down as hard as you can, comfortably without hurting yourself. Okay. Okay, right, okay. Okay, now just the lower part for me if you can. Okay, good. Have you been having any weakness or problems while swallowing? Have you randomly gagged on anything recently that's out of the ordinary for you? And I'm not just talking about like whenever you brush your teeth, anything like that, because gagging while you brush your teeth is normal. Many people do have a gag reflex, and that is a sign that your brain function, or at least your motor function, is healthy, because that is saying that your body is still signaling your brain to, hey, I'm touching this gag now, and that's good, because that's what's supposed to be happening. Some people don't have it, though. Yeah, you're right. But normally, people do. Most people do. Yeah. So nothing out of the ordinary like that. Okay. Yeah. No, that's fine. I just, I think that it felt like you may have been struggling a little bit to bite down. And this is, nothing to be concerned about. I just wanted to make sure if there's anything else, because there are people who have like TMJ. This is, a disorder of the jaw where sometimes it can clench up or tense up, and it can make it hard to move your jaw, hard to talk. It can also produce a clicking sound that can be really loud. And so these are things that can contribute to that. Right. Yeah, stress can cause that to become worse, as well as grinding your teeth while sleeping. I personally do that. So, speaking from experience, it's not fun to deal with, and heart goes out to people who do. Yeah. Okay. Well, I guess. All right, I'll do another thing really quick before we go back to the light. Since we're already talking about that, what I want you to do is I'm going to have you open your mouth, and I want you to stick your tongue out, and I'm just going to depress it just a bit, just to see how the muscles in the back of your throat react. Make sure that they all have a reaction. I'm not going to gag you or anything like that. I'm not going to attempt to stick this in the back of your throat. I just am trying to get an idea and see that everything's going normally. Okay, so just okay. Okay, I'm gonna press down just a smidge. Okay, good. Yeah, everything's good. It doesn't seem like that you have any issues, And I mean, sometimes, like anything else, like regular muscles, they can get tired. They can, you might even have like a little knot in it or something and you don't know. These things happen. And, unless it's a chronic pain that's been lasting for weeks at a time and it's truly affecting the quality of your life and it's not a temporary touch and go type of situation, definitely come back, let us know. We have specialists that can help rule out things and take a closer look. Yeah, definitely get you some specialized one-on-one time with one of our clinicians, one of our specialists, definitely. We'd be happy to do that referral for you. Great. Okay, so you have your smell, your taste is good, eyesight's good so far, your reactions are good so far, and the sensations. So what we're gonna do really quick is we're going to test the responsiveness of your pupil to see if it dilates whenever I bring the light near it. Okay, so we're gonna do it like last time, but instead of me moving it across your field of vision, what I'm gonna do is I'm going to bring it, slowly position it, bring it out, maybe bring it back in, just to see the type of response that I'm looking for. Okay. All right, so just look straight ahead, past me, like there's somebody behind me that you're trying to get a better look at. Okay. Okay, good. Now, across to this eye. Wonderful. Good. Yeah, just as I expected, everything looks normal, looks wonderful, and looks great. Okay, so what I'm going to do is I'm going to touch the kind of like this part of your arm, but I'm either going to use this side, the dull side, or I'm going to use this bit more pokey side. It's not at all sharp, it's not going to hurt you, but there is a big discernment because this side is much harder and is going to be a bit more rigid, and this is a silicone piece, so it gives very much so, as opposed to this side. Okay, so what I want you to do is just close your eyes, okay? And I'm going to, on this upper part of your arm, okay? All right. Keep them closed. Go ahead. Close them. Okay. That's right. It was the dull side. Okay. Now close your arm. Close your eyes again. I'm going to touch the upper part of the arm again. And I might do the same one. I might do a different one. I'm not sure yet. Okay. I haven't even decided. Okay. Close them. Close them. Yeah, you were right. I did just do the other one. Just to make sure. Just to make sure that you didn't have a good guess. Okay, yeah. Alright, so one last one with the tongue really quick. What I want you to do is just stick it straight out. Like as if you were like sticking your tongue out at me like Okay, but what I want you to do is give yourself a bit of space in your mouth and open your mouth a bit wider than what I did, but I want you to move your tongue from right to left as if you were trying to show me the side of your tongue, but without moving your head or your neck. Okay? Don't move your neck to show me. I want you to stick out your tongue and move your tongue to show me the side of your tongue. That makes sense? Okay, so stick it out. Back again. Perfect. Okay, good. Good. No, it's wonderful. Yeah, just as expected. Last one. Okay, so last little test, and then I can, make my notes, have the nurse come in. I think that there might be other stuff that the general doctor wanted to talk to you about. I'm just the brain doctor. Yeah. But yeah, what they're probably going to want to do is might want to keep you for observation. I'm not sure. I think that with everything that I have so far, I'm going to recommend the minimum amount that they would hope that you would need. And, if there's anything out of the ordinary, you can, of course, come to me with questions about that. I could totally go over anything that I had done today or that would pertain to the care that I would potentially need to provide to that. Yeah. Okay, so for this last one, what I want you to do is I'm going to put my hand just right here on your chin, on your face, and I want you to try to lean into my hand, but as if you're trying to turn your head to move my hand. But I'm gonna push back on it, okay? Alright. So, I want you to do that, okay? So I'm going to put my hand right here, and I want you to push on it with your head, okay? Alright. Start turning. Okay, good. Let's do this other side. Start. Okay, great. Okay, so for this next one, I'm going to put my hands on your shoulders just like this. Well, I guess like this. I am facing you like this. And I want you to push up on my hands, but I'm going to push down. It's like I'm pushing on myself, and you can see that go down a bit. I want you to do that as well. Okay. All right. Okay. Again. Okay, good. Let's do it again, just one more time. Okay. I think that, yeah, I would say that you did take a Probably a little bit of a nasty spill based on the various bandages and bruises on you, but I don't see any casts. I don't see any slings. I don't see any temporary ankle contraptions, braces. Yeah. So I think that you're probably all set. Fingers crossed for a very short stay. I'm sure that you probably won't be going home tonight. They did tell you that. Yeah. Just because, you know, especially with this brain injury stuff, it can be very touch and go. We want to make sure that you are 100% okay before we leave. Or before you leave. Before I leave, you probably will still be here whenever I come back for my next shift. But who knows what'll happen. Heck, we might be leaving at the same time. Never know. But yeah. I'm gonna go ahead and just finish up in here really quick, clean it up, let you get back to recovering, give you your privacy again. You know the call button. Get in touch with us. Yeah. Okay, good. And if there's anything else you need, don't hesitate. I'm going to clean up, make it up. Okay. Alright. If I do not see you again, rest up. However, it was nice seeing you. And if I were to see you again, it wouldn't be an unpleasant experience, I'm sure, but I hope that you're not. Because if I do see you again, it means you probably haven't gotten better or you're in the hospital again. And neither of those are great for you. Yeah. Okay.